pregnancies in which oftentimes you establish a close relationship with the parents because the surveillance has to be instituted and may go on for weeks and weeks and weeks. In this case, fortunately, it went on for months. And so you establish a very personal relationship. You get to know very well the patient, the husband. They get to know, or at least I try to have them complicit into what we're doing, what the situation is for the fetus, what parameters we're monitoring, and what the information is, so that everybody is on the same page. And in this case, the couple was a fantastic couple. In general, pregnant women are very compliant, I have to say. But in this case was a very educated, very happy couple, very involved, very understanding of the issues without ever letting this news scare them too much. I never had the feeling that they were overwhelmed, and that facilitated, of course, my job tremendously. So I remember them following them, and this growth problem in the fetus fortunately never progressed to the point of compromising the fetus. In fact, we saw a temporary improvement when the mother was able to stop working, and she was able to overcome a stressful period in her job, and that led to an improvement in the fetal growth. So I was overjoyed to see that a spontaneous kind of decision on the maternal side had beautiful impact on the baby's rate of growth. It was a surprising but a beautifully surprising news. And the pregnancy did continue until we had to deliver the baby, but the outcome was spectacular. And I was very, very happy, particularly for this couple, in which, you grow very attached to some of these couples that you see daily, twice daily, or weekly, or twice weekly. And you get to know them so well. Many problems in the growth of the fetus can occur in second, third, or fourth pregnancies, usually in women who have medical conditions that may predispose to poor fetal growth. But one of the challenges in terms of placental implantation is with the first pregnancy. This is the first time in which a woman allows a foreign organ, which is the placenta and the baby, to implant in her body for 9 months. So in a way, think of it in terms of organ transplant and organ rejection is something magical that happens there. There is a lot of interaction with the maternal immune system, but it's also the first time is also when something may go wrong. So if the placenta does not attach properly, or if there is a reaction in the mother that does not allow the proper placental implantation and the kind of rooting of the placenta into the wall of the uterus, then you see the consequences later on in the poor growth of the baby. And this is more common with the first pregnancy.